drug-induced liver injury or drug-related liver injury. How do we make a diagnosis? Number one, we have to be aware that there's no gold standard test to say, do the test, yes or no, that the liver injury is caused by a particular medication. There's no gold standard test. The doctor need to have some experience in liver diseases, have a high index of suspicion, and have to go through the following steps. So when a patient come in and ask me, doctor, I took a statin and my liver test is abnormal, do I have liver injury caused by the statin? And we will go through a few steps. I explain to them that number one step is there have to be a normal liver test to begin with. So if you are starting some medication for that a known side effect on the liver, you should have a baseline liver test. So a baseline liver test showing that the liver is normal. And then there's a challenge. That means there's offending drug. And after the challenge, within a few weeks, usually less than a month or 2 months, there's an abnormal liver function. So there's an injury. So there's a normal liver to start with, there's a challenge. After that, liver become abnormal. And when we recognize it, we remove the challenge, we call it de-challenge, and the liver improve. And after that, preferably, if we want to be academic and be certain about that, we give one more called re-challenge, and the liver get bad again. I repeat, normal liver to begin with, a challenge. Abnormal liver, de-challenge. Liver become normal again, re-challenge, and then the liver become abnormal again. What are the common, and the drug has to be probable or known to cause liver problem, and we have to exclude other coexisting liver injury. So I'll give you an example. Somebody having high cholesterol, when they see a doctor, the liver was normal. Let me give an example. Someone taking vitamin A analog for acne, so the Roaccutane, for example. The Roaccutane is well known to cause liver damage. The dermatologist or the aesthetic doctor normally would do a liver function test first. So the liver function test showing that the liver is normal. The doctor then prescribes Roaccutane for the patient's acne or pimples. And after 2 months, the doctor does the test again. If the liver test becomes abnormal, at that time, the doctor should suspect that the abnormal liver test could be caused by Roaccutane, because liver was normal before, and because Roaccutane is well known to cause liver injury. Then there must be a process of de-challenge. They remove the Roaccutane, and then the liver become normal. Usually, this will establish drug-induced liver injury from Roaccutane. Of course, we have to be sure that Roaccutane causes liver damage, and this is well known. Second thing is we have to be sure that we don't miss anything else, such as, say, a gallstone disease or hepatitis B, etc. If you usually will stop here, but if the patient needs the drug, it's a life and death drug, then there's no alternative. We want to use the drug again, and we want to be dead serious about it. We can actually give a re-challenge, and the liver get worse again, and then we can be sure. However, in real clinical practice, a lot of times it is not so simple. For example, we have patients referred to me, they have abnormal liver function test and they have a lipid problem. His doctor started the patient on a statin. So the cholesterol dropped, but the liver become worse. And they asked me, is the statin causing the liver injury? Is it a drug-induced liver injury? At this time, we have to go back to the basic and ask the patient, do you have a baseline liver function test? If there's no baseline liver function test, it will be difficult to ascertain if the patient's liver injury is definitely caused by the statin, because most of the time when they have a high cholesterol problem, they tend to have fatty liver. They can also affect the liver. So if we don't follow all this routine, it is difficult to manage. To sum up, drug-induced liver injury, there's no gold standard test to diagnose it. You need experienced hepatologist to think about it, high index of suspicion, follow the rule of normal, challenge, abnormal, de-challenge, normal, re-challenge, abnormal. So, not easy. What are the commonest drugs that I've seen as a pathologist that cause drug-induced liver injury? First is Roaccutane for pimple. Second thing is methotrexate from the rheumatologist. The third is various chemotherapy from the oncologist. The next is tuberculosis drug from the infectious disease or the lung specialist. Lastly is a statin from the cardiologist and the endocrinologist. So These are the common drugs that we consider for drug-induced liver injury, but every drug can also potentially cause that. It's quite messy, isn't it? Not an easy problem to diagnose and to manage. Hope you learned something. Drug-induced liver injury.